Welcome to the Scott Townsend Show, brought to you by Dietzo Man Productions.
Hey, this is Scott Townsend, and you're watching, listening to the Scott Townsend Show. And today I have with me special guest, Dr. Joshua Gentges. Good morning. How you doing?
Great. How are you today, Scott?
I'm doing pretty good. I appreciate you joining us today. We have I would call this episode, it's a special episode, I would say. It's going to be short and sweet and to the point. From a national and local perspective, masks or the wearing of masks, there seems to be a lot of opinions floating around as far as should you or shouldn't you, what do you wear, how do you wear it, all this stuff. And Bartlesville, and I'm a part of the committee that's helped design this Protect Our Herd campaign about, outside of a mandate from the state to wear a mask. We thought we had an opportunity to create this public information campaign to help draw awareness to some simple things that we can do to help curb the COVID virus. The campaign is made up of three things: wear your mask, watch your distance, and wash your hands. So I appreciate you joining our show today to lend some medical authority to this subject. So from a national perspective, whether you're in California or Florida, it's all relevant. From a local perspective, this really helps your being on the show today really helps reinforce the message that we're trying to get across to the local community. So that was a long introduction there, but I'm going to turn it over to you. Why wear a mask?
So the importance of wearing a mask is to help us mitigate the spread of the coronavirus that causes COVID-19. When we wear a mask, it helps contain and prevent the droplets. Every time you say or anything or cough or sneeze or open your mouth, really, small droplets that you can't normally see come out of your mouth or your nose. And if you are infected with the coronavirus, they can then spread to others. A mask helps prevent those droplets from spreading to others. And even if some of them get past the mask, their velocity is slowed, so they can't go as far. For example, if you wear a kind of standard 2-ply cotton mask, droplet penetration will lessen in distance from around 6 to 10 feet down to just a few inches. And so that protects people around you.
So, and, as a doctor, and as you work at Hillcrest Medical Center, and you're an emergency room medicine doctor, and you teach residents emergency medicine.
That's right.
You depend on the masks basically to help save your life while you're trying to help save someone else's life.
We do wear them all day, every day at the hospital. And when we go into patient rooms, we will add an additional mask called an N95 mask. Now, those aren't necessary for the public out in the world, going to the grocery store or the pharmacy or whatever. But certainly we wear them all day long. They don't cause your oxygen levels to go down. They don't cause your carbon dioxide levels to rise. They don't increase the risk of infection with bacterial illnesses. All they do is protect us from the spread of respiratory viruses and other respiratory pathogens. And the one that we care about the most right now is the coronavirus that causes COVID-19.
So how to wear a mask? I've heard a lot of opinions around this. What's the proper way to wear the mask?
So the take-home point on wearing your mask is that it should cover your nose and your mouth. If it does not cover both your nose and your mouth, then it's ineffective. But if it does cover your nose and mouth, then it will be at least somewhat effective in preventing transmission of the virus. And every layer of protection helps slow down the transmission and will reduce the number of people in your community that develop COVID-19, which will reduce the number of hospitalizations and help, Jane Phillips Medical Center, be under less stress, for example. and also reduce the number of deaths, because the number of deaths in all of our communities in Oklahoma has been tragic, and Washington County is no exception to that.
So the burden on the hospitals right now, what's your, I have no idea. From your perspective, what's it look like?
So I worked yesterday, and the day before, and the day before, and the day before. But essentially, we're full. Every hospital in the state is near full capacity. We are at full ICU capacity or past that in most counties in the state. Here's an example. We're getting transfer requests from hospitals that aren't even in our state, from Arkansas and Texas. I got one from Paris, Texas the other day because they couldn't find any place. We're 4 hours away from Paris, Texas. They couldn't find anywhere else to send anybody. And so that's bad, not just for the big hospitals, but for little hospitals in small towns. They may not have all the specialties they would need to take care of, let's say, a cardiac patient or someone with cancer. Those patients need a higher level of care, and right now it's very difficult for me to accept them because I have no place to put them.
Wow. What are the best masks? If I'm going to go out, I'm listening to this show, and I'm convinced that I need to start wearing a mask if I haven't done so already. Or maybe I'm a mask wearer, but I think I need to upgrade or get one better. What are the best masks to get?
This is a great question, and the answer that we've settled on from the CDC and from other public health entities that are talking about mask wearing is a 2-ply cotton mask. That is what we suggest for the public. It should fit securely around your nose and your mouth and cover both of those things. And some of these masks that are 2-ply cotton masks also contain an inner pocket in which you can put an additional filter if you want additional protection. Honestly, it's probably not necessary. One thing I would say about mask wearing, I will see people who are wearing, for example, a handkerchief as a mask. These are minimally effective, but one of the problems with that is because they're open at the bottom, if you sneeze or cough, respiratory droplets will escape out of the bottom of that mask, and so it won't be quite as effective as one that fully covers your mouth and nose.
So I guess that holds true also for the clear face shields.
Right. A face shield will protect you to some extent from droplets, but unless it's completely enclosed, and then those plastic ones you couldn't breathe if that was the case.
You're right.
It won't be effective in preventing you from transmitting the virus to others.
What about these masks that I see with the little round disc on the side or something? I'm not quite sure what that's all about.
Another good question. Those are ventilatory ports, and masks like that will protect you to some extent, but do not protect other people because those vent ports are designed to let things come out of them. So droplets and aerosols can come out of them, and they can contain the virus.
The last question I have regarding the masks is, where should you wear the mask?
I think, and this is also the recommendation from the CDC, that you should wear a mask anytime you're around people who are not in your immediate family. So by around, I mean in an enclosed area or within 6 feet whenever you're outside, or at really any distance if you're inside a building. You should have a mask on whenever you're around people that are not in your immediate family. That means, if you're around your parents or your cousins, or if you've gone to a holiday gathering or a wedding or something like that, if you have to be around others, you should wear a mask.
So that's a great point. We've got Christmas coming up this week, and so say that again. With people that are planning on visiting their parents or wondering if they should, or getting together, small groups, what's your recommendation this Christmas?
So I understand that people really want to see their families. I miss my family immeasurably, and I haven't seen my my dad or my mom in 6 months. And that's been hard on me, and it's hard on everybody. I think that we should be careful if we're going to gather in those ways. And certainly the best recommendation and the way to keep people the safest is to not gather in person. But if you have to, and there are reasons why people will have to gather in person during this holiday, if you have to do that, I would implore people to wear a mask, to stay socially distanced from people that are not in their immediate family. So that means stay 6 feet apart, and to wash your hands frequently. So if you pick up a glass or something to eat, or if you're, going to the table where, the Christmas spread is set up, wash your hands before or after you touch things. And certainly, when you take your mask off and on, you should wash your hands when you do that. And that's kind of the best way to help keep everyone in your family safe if you have to meet during the holiday.
Okay, so that's Christmas. And you said you have not seen your parents in 6 months. And that's not because you live on the other side of the world. You're only 45 minutes away, and still,
that's right.
You've exercised extreme discipline to help minimize the risk there.
I think it's important for physicians and public health professionals, and I'm both of those, to model good behavior. And the right behavior that will keep my parents safest is for me not to see them until, I'm vaccinated and they're vaccinated, and, the risk of the virus has gone down.
So that's we'll end it on that. When do we get the all clear? Well, when do you think, when are we going to be able to take off the masks?
That's a really good question too. I think that whenever enough of the population has been vaccinated, that the coronavirus can no longer spread what they call exponentially, where it can grow and grow and grow each week. And where levels of community spread have fallen to the point that that we're able to appropriately, contact trace and test small numbers of cases to prevent further outbreaks, that's when we'll be taking off the masks. If you're asking for a timeline, I would say I would expect that somewhere in the late spring or early summer.
A 2-ply cotton mask.
Yep.
Are those blue surgical looking masks?
No, the surgical masks in general, they're less comfortable than a cotton mask, and they don't work any better. We use them because they're disposable, and that way, like if one gets contaminated, I don't have to throw it in the wash. I can take it off and then put a new one on. For the public, we recommend that if their mask is potentially contaminated, like if they've been out in the public or if they've touched their mask or whatever, they really should wash it at the end of the day every day, and that way it'll keep it clean and fresh.
Why do you think people are resistant to wearing masks?
Because they've been convinced by people that they love and trust that masks are dangerous. That's why.
I think it's also interesting that the leadership in the country are also divided. You'll see some that are telling us to do it and some don't, and so those of us down at the bottom of the ladder aren't quite sure what to do.
Yeah, it's bewildering to public health professionals that this has become politicized. We don't understand it. We don't know why it has become politicized. And it shouldn't be politicized. The science is not difficult, and the benefit is clear.
And so your opinion on Bartlesville's initiative to this information campaign to help kick Corona to the curb?
I hope that the initiative works and that it convinces every citizen in Bartlesville to put a mask on.
Well, Dr. Gentges, I really appreciate your time this morning, visiting with us, lending your professional expertise to this very critical and important issue. Dr. Gentges with Hillcrest Hospital, emergency room medicine, and teaches emergency medicine to residents there in Tulsa, Oklahoma. Thanks for your time. Thanks for your information and helping us.
Thank you, Scott. I appreciate the opportunity.
So for Dr. Gentges, this is Scott Townsend. Thanks for watching the Scott Townsend Show, and we'll talk to you later.
The Scott Townsend Show is a Dietzo-Man production. For more episodes, visit the Scott Townsend Show YouTube channel, listen on Apple Podcasts, or wherever you listen to your favorite shows.